Okay.
Okay. Hi, everybody. Welcome to Sunday evening. I cannot believe here we are wrapping up toward the end of January. Thrilled to be back with you again tonight. Many of us were just saying how lucky, how fortunate we feel to be with Glenn as our tour guide. Glenn Grossman, our esteemed epidemiologist. He's been our tour guide for so long now, and we just feel so lucky that you're giving us so much direct and unbiased information that we can count on. And we just feel like you've been this rudder on this ship during this turbulent storm. And we just feel so grateful, Glenn. So thank you from the bottom of all of our hearts. We are just saying that as many of us were logging on.
And
So
thank you, Rebecca, and thank you everyone for joining. I'm getting as much value out of this as everyone else. I really enjoy being able to be there for everyone, and it's keeping me on top of the literature, so it's great. Thank you.
thank you. So my name is Rebecca Berman. I am proud to be moderating our discussion tonight. Thank you to everybody who has sent in questions during the week. Glenn has been busy preparing slides for a very comprehensive conversation. We'll be talking about the vaccines. We'll be going around the world. We'll be going around the country. We'll be talking about the variants that we've been talking about over the past few weeks. We'll be talking about the change in the administration, and we'll be talking about the reactions to vaccines, all different kinds of things tonight. Should you have questions that come up during our conversation, please chat with me privately in the chat box below, and I will try my hardest to weave your questions into our conversation. And if I am unable to, certainly Glenn will answer your questions in our conversation next week. Okay, so Glenn Grossman is an epidemiologist with over 20 years of experience. While pursuing his doctorate in epidemiology at UNC Chapel Hill, Glenn served as an epidemiologist on staff at the UNC Infectious Disease Clinic for 2 years and taught epidemiology and advanced analytics at Duke Medical School and at UNC. He has been involved in epidemiology forecasting and advanced analytics with Bristol Myers Squibb, Sanofi, Novartis, Medicare, Medicaid, Veterans Health Administration, Military Health Service, the CDC, and other programs within the United States and abroad. All views expressed today are his own. Okay, so as usual, Glenn, let's jump in and take us around the United States and just quickly around the world. How are we doing?
Thanks, Rebecca. All right, so let's share the screen. So major change since last week. Forget about what we're looking on the screen. We'll get to this a little bit later, but so we have a new president now. The United States has a new president. And the very first thing that that Biden did when he came into office was pass a huge number of new authorizations, presidential executive orders, and other authorizations. And so there's a lot to discuss tonight on that front. We now have a strategic plan. We literally never had a strategic plan on how to address COVID-19 under the previous administration. And so now we have a lot to discuss there because there's a very detailed 200-page document that I've summarized for tonight on the strategic plan of how the U.S. intends to address COVID-19 for the next few months and years. All right. So what we see on our screen here is we've talked about this a little bit before. So the numbers seem like they were coming down at the beginning of the year, and definitely they're continuing to fall dramatically. So it looks like we're past the peak of the surge in terms of cases. The hospitalizations have been going down, and the deaths have started going down. This is really great news for this surge. The numbers are still out of control. So for instance, when we look at the deaths, what we're talking about here, we're still averaging over 3,000 deaths a day from COVID-19. And so it's still crazy but luckily it's not increasing anymore. As bad as it is, it's not increasing anymore. And so if you see the previous surges, we typically had a sharp uptake, and then the downside was a lot longer. And so similarly, the surge over the summer, it was a shorter uptake, and then the downside was a lot longer. So if we have this uptake here, then the downside might be months, and a lot of people under the people who all die under the what we call the area under the curve here, um, is almost is well, you can see based on the distribution that the numbers that die after the peak have been more than the numbers that died before the peak. And so that means that we're not anywhere out of the woods yet. What all that we know that you can see right here is that we're no longer increasing the number per day of deaths. And so that's an early sign of this is good. But we're nowhere near out of the woods. And so there's a lot that the Biden administration can hopefully do to more rapidly decrease the surge. In fact, that's going to be one of the first things that I'll look for here. Well, there's a bunch of things I'll be looking for. But if the shape of the curve decreases more rapidly than either the first surge or the second surge, then this will be a clear indicator that the Biden administration's interventions were likely the cause of that success. Because you can see just as things were playing out in the states on their own, there was a much longer, it was a shallower slope on the way down. So hopefully we'll have a much sharper slope on the way down this time. When we're looking at where we are, a lot of states have policies in place at this point to reduce the spread. So, for instance, there's various degrees of lockdown and constraints on people interacting with each other. Some businesses are closed in different states, and so that's the primary reason why we're seeing this decrease. When we look at the regional level, we can look at the regional level hospitalizations first. So you can see that there has been a decrease across the country. The Midwest, which started the surge the most, this third surge, they got to the highest peak first. They've been on a downward trend for a while, but then in the last couple of weeks, we've also seen the West start to go down. California has put some major constraints in, and they were a major source of the virus. The South has started to go down, and the Northeast has sort of peaked out, and it looks like we're beginning to go down, and we're on the other side of the peak there. In terms of hospitalizations, all right, so I prefer to look at the relative amount. So you can see that there's still a lot of states that are overwhelmed, which is consistent with the data that we were just looking at, that there's a lot of states where there's a lot of people in hospitals. So for instance, where I live in New Jersey, we're past the peak, but there's still quite a lot. New York is maybe at their peak, hopefully at their peak, but they're not on the way down yet. California that we were just talking about, they are, it's hard to tell what's going on in California, but it's interesting. There's all these variants that we've been talking about. And so the United States has done a really, really poor job of screening for the genetic sequences of the virus in the United States. So we're finding out about the genetic variants in the UK because they're doing an enormous amount of genetic screening, and in South Africa, and so some of these other places. In the United States, there's likely to be variants. In fact, there's a new variant that they think they've identified in California that might be responsible for some of the increased spread there. We don't know yet in terms of whether it's responsible. But my point is that we haven't had a consistent approach to genetic sequencing, to screening all the variations that have now happened in the United States. And so I really hope the Biden administration includes this as a focus. It wasn't clear to me yet whether they will. I'm very confident that they will based on having read their strategic plan, but this is definitely something that I'm looking forward to seeing. All right, in terms of the single day highs, you can see that it's been a few weeks since we've had any state have their high. So it's currently January 24th. You can see that no state has had its highest week in this current week. They've all hit their peak and are all either slightly on their way down or dramatically on their way down. The majority of the states hit their peak around January 3rd or December 27th, that the week of the ending in those dates. So so this is good. Um, when we look at vaccines, I'm going to jump to vaccines now. Well, first I'll look globally. Give me 1 second. All right, I'm looking at vaccine here. This, and I'm looking at one other thing. All right, let me do this again. All right, so in the US, here is the vaccine roulette in the United States. You can see that the darker the state is, the more aggressive they've been rolling out the vaccines. And so more people have been vaccinated there. So North Dakota, South Dakota, they got hit, as you know, a month ago, couple months ago, they were hit really hard first. And so even though they were on the downward side now, I think that they have a lot of anxiety about repeating that. And so as a result, they've been vaccinating quite a lot. You see some other states that have been hit hard and have also been vaccinating. But there is wide variation. Has not been a really good systematic approach here. And so because of each state decides for themselves what they want to do, it's there, we see this wide variation across the states. When we're looking at the world view, I'll jump to the global view here. These are currently some of the main countries that we're looking at in terms of how much vaccination is being done. Israel already, they're already at roughly 42%. This is amazing. Within another month or two, almost 100% of the population is going to be vaccinated. And that's just really great news. I mean, that's as soon as the majority of people are vaccinated, then you can reopen the economy. Everything's back open. It's really going to be game changing for Israel and these other countries that have made this commitment. United Arab Emirates, 25%. It's amazing that they have achieved such a high level so far. United Kingdom is at 10%, which is interesting because let's see where we are. So United Kingdom has been a little bit higher than us for a while. I'm seeing. So they've stayed on an upward trend, and so 10% is great. The United Kingdom needs it more because they have the UK variant there. That's the mutation, the set of mutations that have spread really rapidly. We think that it's around 50% to 70% more contagious than the original version in Wuhan. In fact, here's a side note. I don't know if any of you realize this, but the virus has mutated so much. So it's first identified back in like December, January of last year, or so December of 2019, November, December 2019. That's when it really started producing these epidemics in China and then started spreading. That original variant is called the Wuhan variant because it was first identified in Wuhan. And the Wuhan variant doesn't really exist anymore in nature. And that's because all of these mutations have occurred and there's all of these new variants. And a lot of the new variants have become much more contagious than the original Wuhan virus. And so as a result, they've outcompeted the Wuhan virus. So now whenever we talk about SARS-CoV-2 or COVID-19, it's almost all these newer versions. So over the course of the last year, we've had lots of different variants that have become more common over time. So it's not unexpected that we are continuing to have new variants appear over time. But in UK, one of the issues is that it's because it's so much more contagious, then it has a bigger impact on people. Because if you can be in the same room with one other person or a couple other people and only have a limited likelihood of getting infected, but then you increase that likelihood by 50% or 70%, then suddenly it's a much more serious virus, even more serious than we currently have it. And so as a result, they're really racing as hard as they can to vaccinate as many people. Bahrain is also doing really well. The United States is at 6% currently, a little bit more than 6%. And then Europe is a little bit further behind. They've had some issues in terms of getting their vaccinations rolled out. All right, so this is what we look at the vaccination. Oh, one other thing that I found interesting that I like to keep on looking at is the ramp up curve. So a lot of times people are complaining that, oh, if over the last month, so it's January 24th, and the vaccine started around December 20th. So if we go from like December 20th to January 20th, oh, if you look at the average is really low. The average is somewhere around here. And so people are saying, well, how can we, let me make it in a way that's easier to see. All right, this is not what I want. I want the 7-day rolling average. All right, so here's the 7-day rolling average. So on average now, we are vaccinating over 1 million people a day in the United States, which is great. But some people have looked at the data and said, well, when you average it over the last month, the average is much lower. The average is something like what, 400,000, 500,000, somewhere over here is the average. And so they said, how are we going to be able to ramp up to vaccinate everyone by summer or by spring or by fall rather? But if you see that even before Biden, I mean, so Biden hasn't really had much influence so far on the new vaccinations. Maybe in the last day, I wouldn't count it yet. But you can see that based on the ramp up curve, if we just continue with this ramp up curve, we are on target to vaccinate the vast majority of the United States population by summer. So that's good. Hopefully we're not going to hit any ceilings in terms of just the availability of the product, because a lot of this product, the vaccines that have been sent out, were already being stockpiled, and then we're just waiting for the emergency use authorization. And so we've been draining that. And so now we're relying on the new drug being manufactured and then very rapidly shipped out, and then very rapidly delivered to the sites and then given to the patients. And so the worry is that at some point the ramp up curve is going to flatten out and we won't be able to continue at the growth rate that we're continuing at. And so that's where the Biden administration can really play a big role. So hopefully we'll see some good things there. So that's basically it. I don't really have anything else to talk about in terms of how things are. Why don't we go into questions? Unless there's any other questions about the state of COVID where we in the US or abroad currently, or if you want to see any specific states, for instance, or any vaccination questions about this.
Len, we have a couple vaccination questions. First, I'm going to ask Marla to unmute. Marla had a question about different populations, family populations. And Marla, take it away.
Okay, so I understand, after you've had the vaccine, you have to still wear a mask. I still wear 2 masks. I've been vaccinated. I had my second vaccine. Tomorrow will be 2 weeks. So I should have my full immunity. If my husband, which he hasn't had it yet, but when he does get it, and I'm vaccinated, he's vaccinated, and my parents are vaccinated, can we get together unmasked?
So that is a really good question. We haven't gotten guidance from the CDC on this yet. My initial reflex is to say yes. There should be no problem to get together if everyone's been vaccinated and have had your second dose, and it's 2 weeks after the second dose of everyone in the room. There shouldn't be any major problem. The worry that I would have, and what might impact the guidance that might come out from the CDC, is if someone is contagious, and so that everyone in that room who's been vaccinated is protected, then if people can still be contagious, then you could potentially still spread it among you. You wouldn't have to worry among yourselves about having severe symptoms or anything like that. Most likely it would be asymptomatic. However, that would enable you to then go out and potentially infect other people the next day, or it takes a couple of days for it to incubate, but let's say 3-4 days later, you could potentially infect other people around you. And that would be the worry. So if you're around people that have not been vaccinated, you should continue wearing your mask for sure. If it's for me, I don't know how much longer we can stop doing it. For me, and instead of giving you guidance, I'm just telling you what epidemiologists are thinking about. The worry would be the risk in terms of infecting other people asymptomatically, so you wouldn't know that you're exposing other people to the virus. In terms of, let me bring up a graph because it's really interesting in terms of this question of neutralized, how well the vaccine neutralizes. And I think I've shown it before, but let me see if I can find it real quickly. Where are you?
Glenn, and while you're bringing up that graph, we have a question. Rachel, thank you for asking about if you can spread the vaccine, if you can still be a carrier and still be contagious while you've been vaccinated. So if you can touch upon that while.
So yes, absolutely. People were found. In fact, I have a few. Let me see if I can get this slide real quickly. What I found is I need a better way to categorize. I guess I could do a search word for this. Here it is.
Well, when you have 1,000+ slides, you've been working hard for this audience, Glenn. So we'll cut you some slack when you're searching through 1,000+ slides.
Let me share my screen because that makes it easier. So yes, we did find that that there were a fair amount of infections, particularly after the first vaccine was given out. By the second vaccine, and so the vast majority were asymptomatic, and then there were some symptomatic cases, but very rare. And it does have a 95% reduction in severe symptoms. The reduction for mild or moderate symptoms are not as impressive. Still very impressive. I think it was like 50%. I don't recall off the top of my head, but that's because a lot of the people who would have been severe have now moved into the mild or moderate area. But so because it's at that point, because you don't have to worry if you've been vaccinated as much about the hospitalization or severe disease or death, then it's not going to be as bad. The one thing is 5%, which is still a fairly large number, 5% of people with the COVID vaccine after the second dose and second week will still get severe symptoms and potentially require hospitalization. And when you're talking about, we've had many millions of people infected in the United States, but there's also many millions of people who have not been infected in the United States. And if the portion of those that would have required hospitalization, it's going to be dramatically reduced. But if 5% of those still do require hospitalizations, then the vaccine is not a universal protector. It protects you strongly, very impressively, but it's not a 100% shield. And so it's important just to be aware of that as well. But the one thing I was going to show to you that I can't find right now, it's not popping out, is this neutralization assay. Oh, here it is. So let me bring this up to the top. All right, so this is really interesting. The arrows are the two different doses. So the first vaccine dose and the second vaccine dose. And then the levels that you see here for each of the lines are the amount of neutralizing antibody in the person's body. And the higher the neutralizing antibody, the less at risk, the less risk there is of them being infected with the virus or spreading the virus. And so you can see after the first dose, there is some variation, but the vast majority of them don't have very much neutralizing antibody. There's some, but not a lot. It's enough to start giving protection from severe symptoms, but it's not really much to enough to see a really huge impact on reduction in how contagious it is. However, at the second dose, you see a remarkable increase in neutralizing antibodies. And so that means that the level of protection against being contagious or getting the virus after is enormous. So between the first dose to the second dose, after the second dose, it's huge. Our best thinking now is that it lasts around 90 days. So that's around 3 months, both if someone is naturally infected and if someone is vaccinated. The protection that they get lasts around 9 months for pretty much everyone. And then possible exception of some of the people who are asymptomatic. It's not quite clear with them. But for anyone who's had COVID, so has had disease symptoms, so at around 3 months, approximately 10% of people can then be reinfected, is our current thinking. And then at around 5 or 6 months, it's closer to 20% that can be reinfected. So we still don't know the true persistence curve long term, but those are the data points that we have so far. All right. Did I answer Debbie's question too there? Yeah, that was the question, whether people could be infected. All right.
So thank you. Debbie actually had a question. Debbie, if you could unmute about masks. There you are.
Hi, Glenn.
Hey.
The question was, earlier today, I saw something about people double masking, and then Marla just mentioned it too. Is double masking now something with these other strains that they're suggesting? Because that's not something I've been focused on, and I'm wondering now if that's something that we should be.
Yeah, it's a really good point. So there's a couple of answers. The most important thing you can do with your current mask is to make sure that there's a good seal, because a lot of people wear their masks and air can escape on the sides, like there might be a gap. And so there's things that you can do. Either sometimes you might need a whole different mask. Some masks just fit better because everyone has all different faces, and some masks just fit different faces better than others. And so you need to make sure that the mask that you wear fits your face very well. And that's the single best thing you can do. Then and so there's other things you can do too. Typically, if you make it a little bit tighter around your face, then it increases the seal a little bit better. There are some things you can find on Amazon where a lot of these masks are made just to clip over your ears. And so you can extend it back behind your head, and it's almost like a band that goes behind your head. So you don't even use your ears at all. There's also these nose bridges that you can put under the mask, and that sort of seals some of the space sometimes if your mask isn't fully covering it and the seal isn't good. But with the second layer, it definitely has been found to improve the efficacy of the mask, that it just lets less in. If we were talking before, for a lot of masks, in fact, I like to come back to this. Let me see if I can find it real quickly. All right. Hopefully I'll find it extremely quickly because it's a really good chart. So what I'm about to show you is, oh, here it is. In Spain. Whoops. Oh, I need to reconnect my Zoom. All right, so there was this study in Spain. Oh, I don't have it here. But basically what they showed is that if you have 5 people in a room, or I think it was even 6 people in a room, and one person is infected, then the question is, how many of the other people will be infected if everyone's wearing a mask? In fact, let me go and show you that, because it was just such an effective graphic. And so if you find, whoops, so let me show it to you. So this was from a couple of months ago that we looked at this. But in Spain, what they found is, so you have a typical room where people are sitting and talking. If people spend multiple hours in the room talking without a mask and one person's infected, then it's very likely that everyone in the room will be infected. If instead everyone in the room, including the infected person, wears a mask, 4 out of the 5 people are still likely to be infected. The masks are not nearly as effective as people think. They are very effective. So by far, it is way, way better to wear a mask than not wear a mask. But there's a lot of variation in how well people wear the masks in terms of how good the seal is, the type of mask they're wearing, and that kind of thing. And so definitely, what the key insight here that we had from a few months ago was, if you're going to hang out with other people, hang out with them outside. try not to spend any time indoors with them, even with the masks. The masks do not protect you as much as you think that they do. If you do need to be indoors, then you need to sort of have a breeze inside. You need to open the windows and doors so that you have circulation coming through. So you actually feel a breeze coming through. Then that's the next thing you could do. With the masks, yes, doubling the mask up does help. But again, you have to ensure the seal is there. Because if you double up the mask and you still don't have a good seal, then you dramatically reduce how effective the mask is going to be. And I think these masks that they were using based on the real world evidence were not the best masks. They were just any mask. And so they didn't all have good seals. Some were made of different kinds of fabric. And so that's why in real world conditions, that's what it is. So if you have typically what we talk about when you double mask is you might have a cloth mask on the surface just for appearance, and then have one of those paper filter masks or a better filter mask underneath. And so then that's typically how I've seen people doing it. All right, Rebecca, back to you.
Okay. Yeah, appearance, right? We ever think there'd be a time where we'd all walk into a bank wearing a mask and say, "Give me some money"? Comic. Thank you, Glenn, for the platform. Okay, thank you. Moving on. Dr. Chunkowski, thank you. Your question, please, regarding the vaccine and children.
Okay, so I realize that we're not going to be able to sit and hug our grandkids, in my case, until everybody is vaccinated. So I know that they did not test the vaccines, either of them at this point, on people under 18 or 16 for one of the vaccines. And I was just curious about what the status is of the testing of the vaccines on our younger population.
Yes, so they are actively recruiting around the country right now for kids under the age of 18. So those trials are going on. They're trying to complete them as soon as possible. I don't know when they're expected to finish up and to report out, but I'm assuming it's probably going to be very quickly, probably within the next month or two. There's not enough vaccine to go around right now, so it's not a huge difference. Doesn't make a huge difference whether it gets an emergency use authorization tomorrow or a month and a half or 2 months from now, just because there's not enough vaccine and there's a lot of 65-year-olds and people with comorbidities that still need to be vaccinated. But there are people, I've been following this. There are clinics, there are facilities all around the country that have been actively recruiting. Some of them have already hit capacity in terms of how many kids have enrolled. So definitely we're on track with that. And
Good.
Yeah, full steam ahead. Sure.
Thank you.
You're welcome. Rebecca?
Question, thank you. That's great news. Okay, Sandy, you're up next. Thank you.
Okay, first of all, Debbie, I read someplace, and Glenn, you can tell me if it's right. If you take a tissue and you fold it and fold it and fold it into a thin rectangle and put it under the bridge of your mask, that if your glasses, for example, are getting fogged up, that's one way to seal it a little bit more. The second thing is, it's kind of rhetorical. This was not my question, Becky, so I apologize, but it's a little rhetorical, but I can't figure out why they don't use the Presidential Defense Act to make N95 masks up the gazoo so everybody could be masked appropriately, especially first line workers. But that seems like a no-brainer to me.
Hopefully we'll get to that in a few minutes when we talk about what Biden has done over the last week.
Okay, but getting back to, thank you, Glenn, but getting back to vaccines, if you get your first shot, we were told that they automatically put aside the second shot for you. But then I've been hearing different aspects of that, and they want to get more people inoculated, and they may be running out of second shots. So if I had a first shot, can I assume that my second shot has been preserved someplace for me when I come back?
So they are not preserving it, but they are reserving it. So there's new doses that are coming out each week, or whenever they're delivered, probably so daily, let's say. And when they're delivered, they know you're in their system. If you've had the first dose, then they know that, and so they're expecting you to come in for the second dose. And so they're getting the vaccines that come in, and so for their appointments, you are already in their system. So it's not that they're reserving it. That's not sitting in a freezer somewhere waiting for you. Instead, when the new doses arrive, you're in their system. So it's more of a logistics thing rather than a preservation of it.
Okay.
All right, Rebecca.
Okay. So let's jump to the next question. Can you tell us about this strategic plan and digest, sorry, the dog wants to participate here, and digest that 100+ pages down into some manageable tidbits for us? What's the takeaway?
I'm thinking, one more question before we jump into that, because that might take a little while. And I just want to, in case we get one other question, and that was sleep. There was a question that someone sent in about whether sleep impacts. Why don't we just jump to that real quickly? And then we can, if I can find it real quickly, and then we can go on from there to the Biden plan. All right, oh, here it is. All right, I need to share my screen. All right, so the question was, does sleep impact the effect of the vaccine? So if you have a good night's sleep in the day or two before you get the vaccine, and you sleep really well in the days after, or it's not a huge question whether you sleep really well, as long as you get enough sleep and the sleep is of good quality. So don't have anxiety over whether you're sleeping well or not. The question is, does that impact the vaccine's efficacy? And so we don't have data that I've seen yet on COVID and sleep, but we have found for a bunch of other viruses, including flu and others, that there's a dramatic impact, surprisingly, a dramatic impact on the on the influence of sleep on the vaccine efficacy. So this is the first one that I'll show you. This is a little bit confusing, so I'll jump to the second one in just a short time. But basically, there were two sets of people. The top line are people who were well rested in the days before the vaccine, let's say the day or two before the vaccine, and in the multiple days after. And then the bottom line was actually people who were not well rested when they got the first vaccine, and then were not well rested in the few days after. And you can see that these lines are not anywhere near each other. They're very different. And the higher the line, the more efficacy there is with the vaccine. So not getting enough sleep when you get your first dose or your second dose makes a huge difference. So if at all possible, you should try to give yourself at least 8 or 9 hours of sleep in the day or two before you get your vaccine, and then in the days following the vaccine for the next few days, because that's when your immune system needs to be at its most powerful. And if you don't get enough sleep and the quality of your sleep is not great, and so one thing that might influence quality, there's two main things that people might think about, are caffeine in the morning and alcohol at night. If you drink too much caffeine during the day, it might keep you up later at night and disturb your sleep. So you might want to reduce your caffeine in the day or two surrounding when you get the vaccine. And then alcohol, it makes you feel sleepy, but it doesn't actually help your sleep. It's sedating rather than giving you good sleep. And so as a result, you should try to reduce alcohol as well. I'll just do this one slide and then we'll go back to Biden while we still have some time. So when you compare, these are a few different studies that were published. When you compare getting 5 hours of sleep or less to 5 to 6 hours a night to 7 hours a night to over 7 hours a night, you can see this dramatic impact in how likely someone is to be infected by a disease. And that's, I forget what they were looking at here, what specific virus. I think it was flu, but I don't recall exactly. But basically, the immune system is really, really impacted by sleep. And so it's so critical to get enough sleep in order to have the strongest immune system that you can. And this is actually something to be aware of for COVID in general. So even if you're not vaccinated, you should, during this period when there's so much COVID going around, so much SARS-CoV-2 spread, we really should be getting as much sleep as possible. I know everyone always says it, but it really has. When you look at the screen, the impact is dramatic on the impact that sleep has on your immune system. And so if you're trying to maximize the vaccine effectiveness, so here's what we see on the right is the vaccine effectiveness, then you can see when you have sleep deprived subjects, these were people who only had 4 hours a night versus the control subjects who had between 7.5 and 8.5 hours that night, you can see a dramatic difference even within the vaccine. So if you want to think, what can you do to have the strongest effect on your vaccine, try to get as much sleep in the day or two preceding the vaccine, because that will ramp up your immune system to prepare it to get the vaccine. And then in the days after, say the 4 or 5 days after, try to get as much sleep as you can. If it means taking a nap in the morning after for an hour or so, that is beneficial. That will increase improve your immune system too. So get the sleep because it makes such an important difference. Thank you for the person who asked that question. All right, Rebecca, I'll jump back in to Biden.
Telling. That's really great data. Thank you for sharing. That's
You're welcome. Yeah, there's all these other questions. We don't get to all the questions that everyone asks each week. There's all these additional ones, but I think the Biden thing is so interesting that let's jump into that.
Let's jump into it. Please do.
All right, so as I think I mentioned a little earlier tonight, there was never a strategic plan ever made by the Trump administration on how to deal with the COVID epidemic. And so governments need strategic plans because it tells you what their priorities are, tactically, how they're going to mobilize and enable what their strategies are. It all flows from that. And so even the logistics and everything that we've seen, it all flows from a master plan. And so Biden, the first day he's in office, releases this master strategic plan that's over 200 pages. So let me walk through that. He issued a bunch of different executive orders on different things, but I'll walk through that in a second. All right, these are the main points of the national strategy now that we're looking at. One is to really focus on restoring trust with the American people, because we had with the previous administration, we would hear some things from Fauci and from other people. We'd hear other things that were a direct contradiction from other people on the COVID task force and from the president of the United States, direct contradictions, and no one knew what to trust. There were a lot of people in the United States who would hear what Trump was saying and believe that COVID really wasn't such a big deal, that it was just the China flu, which was just another flu, which is totally not true. And so people didn't know who to trust. And so now this is going to be one of the top things, to really get the evidence together and clearly communicate reliably, accurately, and consistently so that the American people can understand what's really going on. This is huge. The second is mount a safe, effective, and comprehensive vaccination campaign. We'll get into each of these in a second, so I'm just going to say them at a high level. Mitigate spread through expanding masking, testing, data, treatments, healthcare workforce, and clear public health standards. Immediately expand emergency relief and exercise the Defense Production Act. So Sandy, this is what you're getting at in terms of the masks. They are enabling this. Trump the president has the power to take over manufacturing plants and just say, for the purpose of this emergency, we are rededicating this and we are going to focus on the emergency. And so Biden has committed to doing that. Another pillar is safely reopening schools, businesses, and travel while protecting workers. The sixth is protect those most at risk and advance equity, including across racial, ethnic, and rural urban lines. The reason that they put this in was not just for political sensitivity. As I've been saying over and over again over the last almost year, there are major differences in the risk of getting infected among different racial, ethnic, and rural urban geographies, as well as the severity of the disease if people are infected. So this is a really, really important priority that we have not included previously. So it's really good to see this. And then seventh, restore US leadership globally and build better preparedness for future threats. And I've been talking about this for many months because the problem is, so for instance, the vaccine rollout, if only the rich countries roll out the vaccine, then that means the virus is going to continue to spread in other countries around the world. And there could be other mutations that occur. And those mutations could come back and then penetrate our defenses of our vaccines because the mutations are still continuing. So it's in the United States' interest to help vaccinate poorer countries and other countries all around the world to prevent the spread everywhere. Because not only will it help those countries and the people there and reduce their risk of dying and having severe disease, but it will also help Americans. So there is a business case to be made for America. It's Americans' best interest or self-interest to vaccinate everyone globally and stop the epidemic globally. And so let me go into these. If you have any questions, Rebecca, just stop me as I go along. Otherwise, I'll continue just diving in. All right, so this is the first. The key actions to restore trust are establish a new structure for decision making that's driven by science and equity. Conduct regular expert-led science-based public briefings. The ones that we had previously were haphazard. They weren't really aimed to the American public in terms of using the best practice. And then I'll go and I just see the message. One thing I want to point out here that really got my attention that I think a lot of people are going to like is, you know how hard it's been to find a vaccine? There were multiple websites you need to go to. You don't know if the vaccine is at this facility in this county or this facility in this county. People could literally spend numerous hours trying to find where vaccines might be. One of the first things that the Biden administration intends to do is build simpler, more accessible digital tools for the public, including for vaccines, treatments, testing, and that kind of other thing, so that hopefully there will be, my hope is that there will be one-stop shopping where if you want to get the vaccine, you go to one website and then it tells you where to go. So you don't have to go seeking it out somewhere around the country, so that it's more systematically. And the same thing would apply for testing, for public health guidance, and for all of this. So that's the first. This is the restore trust with the American people. The second, mount a safe, effective, comprehensive vaccination campaign. So Biden has stated that he wants to have at least 100 million shots by the first 100 days of administration. Now, 100 million shots, remember, everyone requires 2 shots. So that's only 50 million people. I'm convinced, based on what we're seeing so far, that the Biden administration can probably hit 100 million people. But all they're committing to so far is 100 million shots. So I'm pretty confident they'll be able to get there. Hopefully they can. But so their vaccination, I encourage you to look at this later, either when I post this on YouTube or the link is below. It's at whitehouse.gov. It's probably better to search for it. It's called the National, let me make this a little bigger again. If you want to read it in more detail, the National Strategy for the COVID-19 Response and Pandemic Preparedness Plan. All right, the next one. Ask all Americans to wear masks. So that's very, very light touch. That's not requiring all Americans to wear masks, which is very difficult for to fit within the authority of an American president. So he's doing a bunch of different things. One of the things is just asking more Americans to wear masks. Maybe that will influence some people. I don't know at this point. You have to remember, after the last administration, many, many millions of Americans don't believe that they really need to wear masks. Just because of the information they've received, they just don't believe they need to. And so it's not clear how fast we can get them to understand that they do need to. But in addition to this, Biden has announced that he's going to be doing a bunch of things that are within his power. So for instance, any time that people move across state lines, that is federal government jurisdiction. And the federal government can now say everyone who's moving across state lines needs to wear a mask. And if you don't have a mask, say you're driving your car across state lines, now you can potentially be pulled over for, I don't know that you need to wear the mask in the car, let's say. So maybe pulling over as being pulled over is not something that'll happen. But that is something that it's an avenue in which the president does have some power. Another area that he has power is he can say in all federal buildings, now everyone must wear a mask. And so that's something that he has authority. And there are many, many federal buildings around the country, including military buildings, veterans administration buildings, etc. So there are a lot of things he can do. He's also planning to partner with governors around states. We'll see how effective that is. Next is immediately expand the Emergency Relief and exercise the Defense Production Act. So let me go through these because these I think are really important. The question that Sandy asked earlier is why didn't they dramatically expand N95 masks for everyone? The president does have it within their power to do so, and Biden has claimed he will. The problem is that rolling out these manufacturing plants easily could take many weeks in order to get it refurbished to how you need it to be set up, so that the manufacturers, all the machinery is set up the way that you need it, and then in order to actually produce and have the ramp up curve, it takes many weeks. So I don't know when we're going to start seeing more masks come out of this, but that's something that should have happened back in February, when we knew that this was spreading around Europe and was already spreading, but it's now only happening in January of 2021, which is a shame. And in addition, there's going to be a huge amount of emergency funding that's going to be sent to the states to bolster FEMA. So FEMA can now purchase more. So even if it's not available directly, there's more money now to purchase it. And so that's going to really relieve things. In particular, the 4 things that they're looking at are more testing. They want testing to be far, far more available than it currently is, and more accurate and reliable than it currently is. And so they're going to be focusing on ramping that up first. The second is personal protective equipment and durable medical equipment. So that's going to be, that includes masks, but it's not just masks. It's all the other things you've heard about over the course of the year for the hospitals that have been running low on equipment. The third is vaccine development and manufacturing. So they're going to be ramping up vaccine manufacturing. And then the fourth is ramping up the key drugs. We've talked about the monoclonal antibodies and how hard it's been to get them. Well, that can be solved by manufacturing more and just making more manufacturing plants. So this is what they intend to do with that. I'm very impressed by everything that I've seen so far, and everything that they've released in the strategic plan. So let me go on to the next. So the 5th goal is safely reopen schools, businesses, and travel. And so specifically within that, I can jump into the schools, what they plan to do. So very quickly in the coming weeks, the administration intends to release a handbook that helps schools and local leaders implement specific precautions and strategies necessary for safe reopening. Can you imagine that? The federal government having a huge amount of information that's really targeted and really, really useful to the schools around the country. And so specifically, they're going to be looking at developing plans for regular testing and making sure there's enough funding for the testing. Next, navigating federal and state requirements, advising and assisting with consent, sampling collection, contact tracing, all of this stuff. They're making a major focus, because one of the things that we discussed last week was that we now know that it is better, and we've known for a month or two, that it is better for kids to have in-person learning at the schools rather than learning at home in terms of their COVID risk. I know it's counterintuitive. Go back to the YouTube of last week or the week before, but it's kids are at higher risk of getting COVID if they study at home than if they study at school. This is for elementary school kids. For college kids, totally different. Once people go to college, it's a whole different ballgame. High school, the effect is not as dramatic, but the effect is most dramatic in elementary school kids. Businesses too are also going to be focused on. So their executive orders were issued for both of these things specifically. There were a whole slew of executive orders that were issued on all different aspects of the COVID-19. And so the two here that are the most important that you might want to look at if you have time and you have a specific interest on schools are what's included in the executive orders for schools and the executive order for helping small businesses. Because a lot of small businesses have really been crippled. And so that's not acceptable. And so we're going to be helping small businesses and other businesses around the country. And so this is great news. If you can send comments to Becky or email me during the course of the week, if you have any questions about specific aspects of the strategic plan that you'd like me to get into, let me know, because I can talk more about it next week. But let me just go through, there's only 2 more goals, so let me just jump into these. Protect those most at risk to advance equity, including across racial, ethnic, and rural urban lines. So for instance, we've talked about this a bunch of times over the course of the last year, but when you look at different racial backgrounds, let me make this to the top. So when you look at people who are American Indians or indigenous peoples to the United States, Asian Americans, Black Americans, or Latinx, and you compare them to whites, American Indians are 1.8 times more likely to be infected. They're 4 times more likely to be hospitalized and 2.5 more times likely to die. And when you look across all these racial minorities, you can see dramatically higher risk. In fact, even Asian Americans who seem to be protected in terms of getting infected, in terms of being a case, they're only 60% as likely as whites to be a case. That reverses, and they're 1.2 times as likely to be hospitalized as whites, and Asian Americans are 1.1%. So this is another way of saying this is they're 10% more likely to be to die of COVID than white Americans. So they're 20% more likely to be hospitalized than white Americans, and 10% more likely to die from COVID-19 than white Americans. But when we say that, then that means another way of looking at this is that Blacks and Latinas are 280% more likely to die of COVID than white Americans. Huge. And this has not been a priority of the United States and prior to this. And so now we're really looking at it. One other thing on this slide is when you look at this by different comorbidities, you can see that there's wide variation based on race. So I'll go on this because there's other things to talk about. But you can see that there's wide variation, and some racial minorities, even if they have asthma or diabetes, they are even at an increased risk just simply because they might be a racial minority. Some are more protected depending on them, and some are more at risk. But there is variation, and we need to be aware so that when we react to it, when the Biden administration reacts, they're reacting proactively and helping those who are at greatest risk. All right, the last thing that's here is restore leadership globally. And there's just a couple of slides I wanted to point out here, or just one slide, in fact. The question is, why are we looking abroad? Why not just focus on the United States? Trump's whole thing was put America first. What does it matter? And Biden is saying, well, one of seven strategic priorities is outside the United States, the World Health Organization, global, and then go from there. And so there's 2 major reasons. One, as I mentioned a little bit earlier, is that we have a selfish interest in that when we protect other people around the world from having COVID, then there's less mutations and less risk for the United States. In addition, the World Health Organization, by developing these strong relationships and having a coordinated plan, this helps prevent people from, I hear you, Rebecca. This prevents other people. It makes it more strategic. It makes it so we can address the pandemic more rapidly and at lower costs. That coordination makes a big difference in terms of time and cost. And then finally, the big thing is for mitigating future catastrophes and future pandemics. And so, if you recall, it's worth repeating again. We, after SARS-CoV-1, so back in the early 2000s, when SARS hit, there was a lot of concern that if another SARS virus were to escape from bats in China, that it could cause a global pandemic. They were afraid of SARS-CoV-2. And so what they did was they implemented all of these plans in China to prevent another epidemic happening. And as you recall, I'm not going to go into details here, in the summer of 2019, Trump dismantled multiple things that were there to protect us if an epidemic were to arrive in China. And so he essentially removed the epidemiologists that were on the ground in China so that they were not there to respond and jump in when an epidemic first started. So we could have stopped it there before becoming a new pandemic. And so SARS-CoV-2 became this crazy pandemic. We need to stop another pandemic from starting like this. So we need to re-implement that, put epidemiologists back on the ground in countries around the world to make sure that if there is a local outbreak, we prevent it from becoming a global outbreak like we saw here. And there's so one of these 7 pillars is dedicated specifically to this global approach, to stopping the next pandemic, before it even happens. And so this is amazing. Everything, I'm so happy with what I'm seeing here. All right, Rebecca, back to you.
That makes us happy. When we hear that you're happy, that definitely makes us happy because you are not always happy with what you're seeing. So that definitely makes us happy. Okay, so we are almost at or we're a little over our hour together, but why don't we wrap up with a couple last questions? And a question came in from the audience about, you mentioned that the vaccine is 95% effective. Can you talk about in that 5%, should somebody become ill, does having the vaccine prevent them from becoming less sick than if they hadn't been vaccinated? Would they,
So,
is there an impact?
all right, so the 95% number refers to reduction in severe symptoms and requiring hospitalization. So the 5% number are still going to have severe symptoms that could potentially require hospitalization. There weren't enough people in the sample to in the clinical trials to know how well it prevents death, for instance. We don't know this yet. So so the 5%, we know it reduces the severe symptoms. People who have the severe symptoms probably are going to be hospitalized. Many of them are going to be hospitalized. So we don't know the details yet. 5% is still a pretty big number, but compared to where we were, we've reduced 95%. So it's dramatic. And so it's probably going to be sufficient. It's certainly going to be sufficient to enable us to open everything back up and to get back to normal.
Okay, thank you for clarifying. Terrific. And then we had another question. Harry, I am going to ask your question since you are not on the screen about, his question was regarding if you get, let's say you get the first shot in your right arm and then you get the second shot in your left arm. Glenn, maybe you can, I know he asked the question to you, maybe you can elaborate further if there's a benefit in getting the second shot in the alternate arm.
Yeah, so let me talk about this. So basically, in fact, let me share my screen again. Whoops. So basically, when you get the shot is this mRNA virus. The shot is not the protein. So the protein is this, like the spike protein. The spike protein is what the antibodies react to. So there's no antibodies that are reacting to the mRNA itself. So no antibody is responding to the shot itself. And so when you give the shot, so there was some conversation, I don't know the answer to this yet, but there's some conversation. If you get the first dose in one arm, some people in the lay community seem to perceive that if you get the second dose in the same arm 3 weeks or a month later, that you might have more severe symptoms if it's in that arm versus another arm. I don't know if that's the case. Here's how it works. When the mRNA vaccine is injected, it needs to get absorbed into a cell, and then it goes into that cell and then churns out all of these proteins. And it's the proteins, like I said, that cause the antibody response to develop. And so there's a specific type of cell that gets that the mRNA is taken up in, and that's these immune cells called macrophages. And so the macrophages take up the RNA, and then what it does is it was just a regular cell, but then when all the spike protein comes out, then it looks as if it's a coronavirus cell. So it's really innovative. And so now you had what was previously just a regular old cell minding its own business that now looks like a coronavirus cell. And so now the antibodies are responding to this. Macrophages are found systemically, so they travel around the body. And so and especially 3 weeks or a month later, from my perception, when we're looking at systemic effects like fever, headache, these other kinds of things, I wouldn't hypothesize that would be the case, that you would have a different type of reaction, like a more severe reaction, if you have it in the same arm versus separate arms. I'm continuing to look into this. I haven't seen the literature yet, but right now it doesn't seem like there's a reason why there would be more severe disease. I mean, perhaps if the macrophages end up in the lymph glands or accumulate in some way, say in the muscle tissue nearby where you had the injection, and then you had the injection a month later in the same place. But the immune system is a system. The immune system is a system. It's a body-wide system. And so I don't think that the local impact matters so much. It's really a systemic thing. But if I hear anything more, I'll get back to you on that. But I haven't heard anything. So this is my gut speaking in terms of whether I think that one arm versus the other arm makes a difference. And I really don't know yet. It's just that for me, it's just the idea that it's a systemic reaction that's caused makes me perceive that it's less likely that one arm matters. But I'll continue looking into it and get back to you.
Okay, we'll accept that. That's a reasonable answer. All right. So lots of good key takeaways tonight. And so maybe we consider wearing 2 masks. Definitely we consider getting lots of sleep. That's always good advice. And everybody continue doing all the good things that you're doing. Continue to be safe, be well. And Glenn, thank you as always for all of your hard work. We really appreciate everything you're doing for us. Good to see you all, and have a good week, everybody. Same time.
Thank you, Rebecca. Thanks, everyone. Have a great week. Bye-bye.